Hi guys, it's Jen and I'm back to give you an update on the healthcare fight. For the uninitiated, last year we took my health situation public and fought to get me covered for life-saving treatment. We went all the way to Washington, D.C. to talk to my senators to get that care. And it worked until this year. Apparently, as of the first of this year, everything that was set up for me last year is null and void, even though it's still the same company and I still have the same numbers. They say, start over. So now I can't even find what's called a service navigator. Last year, I was assigned a service navigator who would help me handle my health care. And we had a bumpy road off and on, but we would get things done. And in the end, we did get my care covered. Now, I can't find that person anymore. It's as if they don't exist. When I ask about it, they tell me there's nothing in my records to indicate anything. And after weeks and weeks and weeks of phone calls, I've finally given up, and now I've reached back out to my senators. I mean, I literally told them, I'm sorry. I'm bothering you again with this. But what you set up for me last year, they took it away. Why take it away? Why make things worse? Why give me more fuel to talk about you? Why not just simply do your job and pay for the health care that I need? I was a provider. We never ask anything about money. We counted on the fact that insurance companies would pay, right? What are you doing? What are you doing? You're not paying the bills. Oh, buy a new yacht. Gotcha. Maybe a new house, second house, third house. Gotcha. United Healthcare literally had a party to celebrate their profits. Like, I'm not making that up. They do, of course. Oh, look at how much money we made. Look at how much money we made. Why we delay care. Why we delay care. Why people die waiting to have care. That's what they do. You know, they rip off the American public. They make these profits on our premiums. You realize that, right? Maybe you didn't. Maybe that's surprising to you. If it is, I'm sorry to be the one to tell you. But did you know that Medicare Advantage private health insurance companies make about $140 billion a year in overpayments of Medicare premiums? They take in more money than they should. They keep it. They celebrate it. They have a party with it. Meanwhile, your grandmother can't hear because she can't get hearing aids, right? I have hearing aids. That's why I'm pointing to mine. Or you can't get into a doctor's office to get coverage because you're out of the network. Oh, that's another good one. You know, I had to have my senators help me twice last year, in which they took a claim for a singular visit, split it in two, and gave it two different claim numbers, and then proceeded to pay the bill half in network, half out of network. They're not supposed to be able to do that. We have the No Surprises Act in place. But last year, Dana-Farber, half my mammogram bill in network, half out of network. Another one of my providers who did a treatment, half in network, half out of network. They're not supposed to do it, but they do. They do a lot of things they're not supposed to do because the rules aren't enforced hard enough on them. And that's what we need, way more watchdogging. And we need them reined in. And we need them to not be able to profit off our pain. That's not okay. We should all be able to get the health care that we need. It shouldn't be whether or not you can afford it, right? Oh, you'll get the heart transplant because you got money. You, sorry, too bad. I mean, that's what this society is. That's what America is. You can't get your insulin if you can't afford it. Ooh, we dropped the price to $35 a vial. Great. The person needs 7 vials a month for that one drug, plus all the other medications. So instead of doing that, they buy 6 and they ration it. Why do I know this? I know somebody who does it. It shouldn't be that way, but it is. There's a medication that helps me see. And I can only get the short-acting version, and I have to use a coupon, and I have to go to the grocery store to do that because through my health insurance, it's $500 for a copay per month. Now, if you're spending $600 a month on infusions, you don't go there, right? And at the time, that's exactly what I was having to do. I've made a host of lifestyle changes. Don't think this is all about medications. I live my life very carefully. If I'm planning on doing something, I know what to do before and after it in order to pull it off. Because that's what you do when you have something that has no cure. And we're all trying to fight to put out the flame. But we need Congress to get on board. We need you and the Senate to force health insurance companies to actually pay for health insurance. How's that for an idea?